Hi, welcome back to my channel. In this video, we'll just quickly go through the Spaulding classification for the surfaces and the disinfection levels that need to be done. So first of all, we have something which is basically we have four types in this. So one is non-critical environmental surfaces. Then we have non-critical devices. Then we have semi-critical, and at last we have critical. Okay, now let's understand. So the first one, that is the non-critical one. In this especially environmental surfaces like the examination table, surfaces of medical equipment, and so on. Now the level of disinfection is low level disinfection. Okay, now we'll just understand also like what is all in all these levels. So in non-critical devices, basically there's the contact to the intact skin surface, so intact skin contact. Now example is like BP cuff, stethoscope, ECG electrode. Now here we require intermediate or low level disinfection. Okay, then coming on to semi-critical. Now semi-critical is in which there is contact with mucous membrane, or there are minor skin breaches. Example, endoscope. Then coming on to the critical. Now in this there is the contact with the normal sterile site. Now this is surgical instruments, implants, and so on. Now these both, they require high level disinfection. Now we'll start from high level. Now in high level disinfection, what you mean is basically all bacterial microorganisms except spores. And what all materials you can use is 2% glutaraldehyde, 8% formaldehyde, then 10%, 6 to 10% hydrogen peroxide, ETO gas. Okay, now in intermediate you can use basically in this you have resistant to Microbacterium tuberculosis, then virus, fungi, and vegetative bacteria. So all these won't be killed in intermediate disinfection. So in this basically you have 0 to 5% iodine, 70 to 90% ethanol or isopropanol, and we have chlorium compounds. Okay, now let's talk about this low level disinfection. In this basically we try to disinfect the surface. Okay, so in this basically we'll just try to kill most of the bacteria, some fungi, kill most of bacteria, some viruses, fungi, but it cannot be like, it cannot kill microorganisms like tuberculosis and so on. In this basically what you use is quaternary ammonium compounds, phenolic mercurial iodophore compounds. Okay, so this completes the Spaulding classification. If you found this video helpful, do give it a like, share, subscribe. Thanks for watching.